eczema. These are obviously more adults with eczema. Usually eczema is more in like elbows, wrists. It's a little baby. Sad. It's sad when it's babies. Psoriasis is autoimmune. It's a T-cell reaction to the skin. So psoriasis is more like a family history. You could have genetic predisposition. Could be something like HIV, stress, obesity. We could have things that could trigger psoriasis, like alcohol, stress, cold weather, certain meds. And this is elbows, knees, and scalp, usually for psoriasis. In severe cases of psoriasis, one of the things they have you do is go out in the sun. What does the sun produce? Vitamin D. Okay? So in the winter, people with psoriasis will do like tanning beds. Because if their body's producing that, and it's helping with their skin. So psoriasis, red skin with silvery scales of inflammation. It's going to be in your nails too, like with the pitting or the oncolysis, separation of the nail bed, nail plate. Psoriatic arthritis is a skin disease. In about 80% of cases. Psoriasis, usually scalp, elbows, buttocks, knees, head. Elbow, nails. All right, tinea. Tinea is from fungal infections, and this is things like ringworm. Ringworm is common. The correct name is tinea corpus, or athlete's foot, tinea pedis, or jock itch, tinea crurus. And this is usually from especially with the athlete's foot, like wet floors, shower, pets. Signs and symptoms: itching, burning, redness. How do we know it's ringworm?
Looks like a...
And what's going to happen to that ring? Is it going to stay right there, or is it going to expand out? It's going to work on expanding out. Okay? So, what does this look like? That we've already talked about? Marginatum, right? Because it's circular. What's the difference between the ringworm and the marginatum?
The ring is marginatum.
Okay.
So this is marginal.
Could be more raised on the outside, versus the marginatum is more flat. Fungal infection of the scalp, foot. It's like a severe case of athlete's foot here. So what happens if this guy takes a shower in the shower that you're in? Yeah.
What
So
happened?
then you get it, right?
Oh, really?
And then it spreads. So
Just the first second?
yeah. So I highly recommend this guy not only gets this taken care of. How can you take care of most of these skin disorders? Like athlete's foot, it's so common it's just over the counter. You know, you get antifungal creams or antifungal sprays over the counter, a couple days, they go away. So if you have this guy in your locker room, just anonymously slip some in his locker with a pair of flip-flops. Here's tinea. This is tinea with vesicles or a bullous at the bottom of the foot, painful to walk on. Herpes. We've talked about herpes, right?
Right.
Herpes is like what? What all can herpes cause?
Cold sores.
Cold sores?
Genre? What is that?
Syphilis?
No.
Herpes, if it stays in our body, can lead to, if you had chicken pox when you're younger, later in life, and you're in times of stress, it can go into shingles. Okay, shingles very painful.
Yeah.
So, you had shingles?
I started getting them when I was 11.
Really?
Yeah.
Do you get it recurring on the same area? Because shingles always follow a nerve root. Painful.
But I had it across sections too. They thought I was crazy at 11 getting
Yeah. They're like, what are you stressed about? Let's talk about this. Overachievers. So, herpes also can lead to things like shingles, or we can have herpes from sexually transmitted diseases. The herpes, the rashes or skin disorders associated with herpes are usually asymptomatic, or they could be itching, pain, burning like in shingles. The first outbreak is worse. It may not have another one, okay? If it gets in your eyes, it can lead to blindness. And usually these sores from herpes will heal within a couple of weeks on their own. Okay, because what are they caused by? Bacteria or virus? Virus. So what can we really do for virus? Nothing. Hope your body's going to fight it off, right? Hope your body's got a good immune system to fight it. Okay. Herpes simplex, like cold sores, sexually transmitted, like herpes lesion. This is more like a shingles. See how it's following the nerve pathway through, very painful. That's a large area actually. That's happened too. It's usually it can be more in a line.
Also like the middle, all the way back.
Just wrapped around. Like how thick?
Like the biggest
That big.
area is like right here.
Not fun. Okay, candida or candidiasis is yeast infection. Pretty nasty. Yeast is always found in the body. It's found in 20 to 50% of healthy women. What causes the yeast to go bad are things like their hormones are off balance. Sometimes it can be caused by things like birth control pills, obesity, or antibiotics. Diabetes, where the mucous membrane is more sugary, gives a nice home for this yeast to live in. Or things like AIDS, where there's a decreased immune system, so the yeast can easily spread throughout the body once it's there. So the signs and symptoms could be asymptomatic, could be vaginal or vulvar pruritus, usually a thick white discharge that looks like cottage cheese, dysuria. It does not look like cottage cheese. Dysuria, painful urination. All right, testing. You can usually diagnose without tests, okay? Or you can do like a certain, make slides and test with chemicals, all that fun stuff. How do you treat it? Antifungal drugs. Most of the time, especially if it's recurring, you want to look at things like a lower sugar diet or no sugar diet. Try to make the body a less capable host for the yeast to live in. So, what do they call this with babies?
Thrush.
What is it?
Thrush.
Thrush. Yep. And what's usually the cause of thrush in babies? Like antibiotics. And the antibiotics kill the normal flora. So then once they don't have the normal flora, their body can't break apart the food and things like that like it's supposed to. So this is not a happy camper, right? Or just a camper. All right, trichomonas is a protozoal infection. Trichomonas is an STD. Affects 174 million people worldwide. Signs and symptoms are gray-green, frothy vaginal discharge and a fishy odor. It could also lead to edema and pruritus. Males that have trichomonas may be asymptomatic, but can they still spread it? Yes, of course they can. Of course they can. You can do a whiff test. What's a whiff test? Do we need to explain the whiff test? No, we're pretty good with that? Okay.
What's a whiff test?
Wow. No, you're learning chemistry?
Yeah.
Wow. Yeah. Don't wow. You want to rule out things like candida or gardella. There's a trichomonas rapid test. Takes about 10 minutes to run. Treat for this is metronidazole. Common name is Flagyl for trichomonas. Okay, so what are the keys with trichomonas? Fishy. Frothy. Waft.
Fishy what?
Fishy. Fishy smell. Green and frothy discharge. All right, general infections are things like chlamydia trichomonas. This is the most common STD. Or you can even go into infertility and do pelvic inflammatory disease. Males could be asymptomatic. Females could be asymptomatic, or 80% could have things like abdominal pain or spotting. Gonorrhea, genital warts. What are they trying to do in Texas? Have you heard about the genital warts, the HPV controversy? Texas? No? So, is there now a vaccine for HPV? Yes. So in Texas, they were trying to make it mandatory for school-age girls to get the HPV vaccine. And parents are like, why do they need to get the HPV vaccine? And why would you want young girls to have this HPV vaccine?
Well, because they know eventually they're going to have sex, so. Yeah, it's like, do I have to say
But if you're a parent, if you're a parent of a young girl, are you thinking that way?
No.
Heck no, right? So the thing is that they want to do a vaccination for HPV with the idea that, hey look, these girls will be safe and they won't develop it because 70% of cervical cancers can be traced back to genital warts. Okay? So the state's trying to do something good here and say, hey look, I think all girls should have this HPV vaccine, and all parents are like, whoa, wait a second. You know, these girls aren't even sexually active yet. Like, why would you force a shot on them for them to go to school?
Don't
You know,
know how much shot they're getting, so they don't go out and get it.
there you go.
But they do have rights as
Right.
people. So they should know what they're getting.
You should. Yep. So there's huge controversy. In fact, I don't think it was involved in this election, but like the last election in Texas, it had a huge following of who was pro-shot or anti-shot or trying to make rules against it or rules for it. So it's pretty crazy. So HPV, how can we prevent ourselves from all these sexually transmitted diseases? Know your partners. Know your partners. All right. Okay, lupus. Lupus is non-sexually transmitted. Lupus is common with this butterfly rash. So with lupus, you get a butterfly rash on both sides of the face and across the nose. And lupus is an inflammatory autoimmune disorder that can affect your entire body. So it's definitely going to affect things like the skin, but it can also affect joints and cause joint pain and swelling. It can affect your kidneys, your blood, your heart. Lupus is like very debilitating. Do you guys know anyone with lupus? It's a pretty common autoimmune disorder. Do you have like a relative or?
One of the elementary school and the elementary school had it.
Did she miss them?
And I just remember her wearing like long sleeves and gloves all the time. And she's like, oh, I get to the sun. Everybody's allergic to the sun.
Yeah. So you picked on her. So yeah, it's definitely heightened by things like sunlight, things like that. The key is the butterfly rash. That's going to be equal on both sides. And it's usually across the bridge of the nose and either under the eyes and over the forehead. So this is lupus. And lupus could cause things like Raynaud's phenomenon. We talked about Raynaud's for a minute last week, right? What's Raynaud's?
No circulation to the tips.
Yeah, poor circulation of hands. Your hands and your feet are like constantly cold. Less circulation to the extremities. Heart problems, lung problems, kidney problems. And what lupus is just like it's, because it's not immune disease, it's like your body's attacking itself. So your body sees itself as a disease or a symptom. And it can start in very young, and that's unfortunate because you're going to have to deal with this for a long time. So here's a butterfly rash. Discoid lupus, erythematosus. This is a subset of lupus. And this is where the cutaneous, the skin, is the only symptom. So this could be genetic and environmental, or it could also be autoimmune. And this is females, late 30s to early 40s. And these can have 1 to 2 centimeter raised red plaque with a brownish scale. See if there's a picture here. See the raised. And this is where they only have the skin disorder. They don't have the heart, they don't have the kidneys, they don't have anything like that. It's just the skin. So they can also go to things like alopecia. What's alopecia?
Balding. Balding.
Hair loss. What's telangiectasis? We talked about that.
The
earlier.
blood vessels on the surface.
Yeah, it's like the surface blood vessels, the reddening, like they saw the picture of the nose where you can see the red vessels on the surface. Could lead to hives, Raynaud's, numb, cold digits. We tested this through a skin biopsy.
What's right now?
Raynaud's is your poor circulation to your extremities, like poor circulation to your hands. Have you stopped that yet? Stop it and then turn it back on. You did? Okay. Alright, so this is discoid lupus. And that's it for 14. So what do we need to know from 14?
Alzheimer's.